There can be a lot to think about when deciding about genetic testing. There's no right or wrong answer, only the answer that is best for you and your family. Some helpful questions to consider are, do I want to know if my baby could have problems before delivery? If I did know, would that information be helpful for me or for my family and/or my doctor for preparation? Would knowing if there was a genetic problem help me make choices about my pregnancy? Or can these tests help me be less worried about problems?
For patients who decide that genetic testing is right for them, the decision involves picking which testing is right for you. Some questions to consider that may be helpful are, what kinds of problems do I want to know about before my baby is born? Only problems that require immediate medical attention, or any problem at all? How sure or accurate do I need to be about a possible problem before the baby is born? If you feel finding out as much information with as high accuracy is important, then diagnostic testing, such as CVS or amniocentesis, may be the best choice for you. Typically, patients who go directly to invasive testing feel that the information gained from diagnostic testing is worth taking a small risk of miscarriage. How early in pregnancy do I need to know this information? If you would rather have information earlier rather than later in the pregnancy, and diagnostic testing is the best choice, then CVS may be better than amniocentesis, given it is done at 11 to 13 weeks. Am I willing to have a procedure that involves a small risk of miscarriage to find out about a problem? If taking even a small risk of miscarriage from a diagnostic test seems too risky, then non-invasive blood work and ultrasound may be a better fit for you. Non-invasive blood test options, such as the first trimester combined screen and cell-free fetal DNA testing, cannot be as accurate or comprehensive as diagnostic testing. If the blood test result shows low odds for a problem, this may be enough reassurance for you. Some patients feel that if a blood test shows a possible concern, at that point, it would be worth rethinking whether or not to have an invasive test. After watching these videos, it may be helpful to take a step back and talk a few things over. Discussing this information with your partner is helpful to make sure you're on the same page and that both are comfortable with the decision. We have found that couples who have discussed this before coming to their doctor's appointment feel grounded in their decisions, whether that choice is to decline testing or to proceed.
We covered a lot of information in these videos, and we hope that you found it to be helpful. If you have more questions, please feel free to talk to your doctor or midwife or meet with a genetic counselor.
Thank you for taking the time to watch these videos, and we wish you the very best for your pregnancy.